Danny, let me read a comment that we saw in one of your posts. I've been waking up in panic attack almost every day, and I'm severely anxious throughout the day. Everyone says don't take anxiety meds because it could be dangerous. But I also hear gabapentin is a safer one to use. Is there any advice on taking gabapentin with Suboxone or any other anxiety tricks?
Those are some great questions. Before we talk about anxiety meds and Suboxone, my first question for someone on Suboxone who has uncontrolled anxiety is your Suboxone dose enough? Do you need to be on a higher dose of buprenorphine? Sometimes just fine-tuning your Suboxone dose will address the anxiety. Now let's move on to the safety of other anti-anxiety meds while on Suboxone. To the commenter, he or she or they are generally right that certain anti-anxiety meds can be dangerous when combined with Suboxone. Let's break this down by the types of anxiety meds. Micah, do you want to start us off with the first class?
Absolutely. So, the first class of anxiety meds that we have to talk about is benzos, or otherwise known as benzodiazepines. This includes alprazolam, aka Xanax, clonazepam, aka Klonopin, diazepam, aka Valium, and lorazepam, which everyone knows as Ativan. So, it's pretty much all the PAMs and the LAMs. This is usually what people are referring to when they say Suboxone plus anxiety meds are dangerous because they're right, it's very risky. Benzos are not the best anxiety medication to take on a regular basis unless it's been determined by your mental health provider or your psychiatrist because it makes sense for you. Now, the reason why is because it's pretty easy to develop tolerance and become physically dependent or addicted to benzos. You can experience severe withdrawal symptoms that can lead to worse anxiety, panic attacks, and even life-threatening seizures. I have patients saying getting off benzos is actually way harder than getting off opioids. And at Bicycle Health, because of these risks, we do not prescribe benzos. Now, Danny, can you take benzos while on Suboxone?
Sort of. If it's done safely under proper medical guidance, I'd say yes, but ideally only under those conditions. You need to know for your own safety that combining benzos with buprenorphine is potentially dangerous because it can cause oversedation, it can affect your ability to think clearly, and it can increase the risk of overdose and death. Benzos themselves may cause respiratory depression, just like how opioids can cause a person to stop breathing. So let's say someone's taking Suboxone, but for one reason or another, they decide to return to opioid use. That person decides to take some M30s and a couple Xanax bars. The M30s alone might not cause complete respiratory depression, maybe just slow down their breathing, especially since Suboxone might be offsetting this effect. But with benzos on board, this could push the person over the edge towards completely stopping breathing. And remember, Narcan or naloxone, the rescue med for opioid overdose, doesn't work for benzo overdose. Multiple studies have shown that concurrent use of Suboxone and benzos is linked to more frequent ER visits, more accidental injuries, and increased overdoses and deaths. A recent study showed that 37% of people who died of a buprenorphine-involved overdose also had benzos in their system. The FDA has even put out a drug safety advisory that there are serious risks when combining opioids and benzodiazepines.
Very true. I also want to add this important thing. Taking fentanyl or oxy and benzos is much more dangerous than taking Suboxone and a benzo. So this is actually a perfect example of harm reduction. Ideally, we want to minimize the risk by being off of opioids and benzos, but we know that life is never ideal, and so at least we can reduce the opiate overdose by being on Suboxone while taking benzos.
To summarize, taking benzos for anxiety while being on Suboxone is potentially dangerous. It increases the risk of serious side effects like overdose and death. But the harm caused by untreated opioid addiction probably outweighs those risks. In other words, don't avoid taking Suboxone if you're taking benzos already for anxiety and you have an opioid addiction. It's safer to be on Suboxone than other opioids while on benzos. But if you're currently on Suboxone and you have anxiety, it can be pretty risky to start benzos. You should have a conversation with your medical provider about this. Now, let's move on to another class of anxiety medications that activate the same receptors as benzodiazepines. We call these GABA analogs or copycats. Some commonly known ones are gabapentin and pregabalin, aka Lyrica. These meds imitate the naturally occurring GABA molecules in our brain that help with calming things down. It's why gabapentin can be used for anxiety, because it literally slows down the transmission of electrical signals in the brain. But the downside of this is that it can cause oversedation. So in the same way as benzos, when combined with other brain depressants, aka downers, like opioids or buprenorphine, there is the risk of respiratory depression or slowed breathing.
In fact, a CDC report from 2020 showed that gabapentin likely contributed to 5% of all fatal drug overdoses. And here's the important part, because 90% of these gabapentin-related overdoses also involved opioids. So then in another study in 2023, it showed that 19% of people who died from buprenorphine-involved overdose also had medications like gabapentin or pregabalin, also known as Lyrica, in their system. So while we can't say that gabapentin caused these overdoses, we can say that it's likely that gabapentin contributed to these overdoses, especially when it was combined with another opioid or Suboxone.
So to summarize here, gabapentin on its own is generally safe and can be helpful for anxiety, but it becomes risky when it's combined with opioids. And remember, Suboxone is a partial opioid, so technically there is some risk when combining gabapentin and Suboxone. When you compare gabapentin to benzos, gabapentin is generally safer and less likely to cause physical dependence. So it's probably safer to combine gabapentin with Suboxone than combining benzos with Suboxone.